Introduction to Papillary Thyroid Cancer by Joyce Googe. The thyroid gland is a small butterfly-shaped gland that has a big impact on regulating your body. Located below the Adam's apple and above the trachea. When the thyroid gland experiences abnormal cell growth and division, along with the destruction of healthy cells originating in the thyroid bed, it is called thyroid cancer. Papillary thyroid cancer is one of 4 thyroid cancers. Papillary is 80% of the thyroid cancers diagnosed in the U.S. and has been on the rise for the past decades. Affecting women more than men, this disease tends to show up between the ages of 30 and 50, but it can occur at any age. Personally, I was diagnosed at age 19. When the thyroid gland is compromised with cancer cells, symptoms may include, but not limited to, a lump or swollen area of the neck, fatigue, headache, and you may even experience jaw and ear pain. Many patients complain of flu-like feelings and persistent hoarseness. Personally, I became depressed, experienced unexplained weight gain, muscle aching, and chronic headaches. No one really knows why some people get cancer, while others do not. I believe some of it is DNA, stress management, and lifestyle choices. What we choose to eat and how we condition our bodies plays a major role in our body's ability to regulate and maintain a healthy system. However, with that said, we also must address the fact that some cancers could be environmental. No one will dispute the fact that thyroid cancer is an environmental cancer. Children are especially vulnerable when being exposed to radiation, as well as people living and or working within 6 miles of a nuclear plant. Since papillary thyroid cancer is a passive form of cancer, it usually takes years to develop the signs and symptoms of the disease after exposure. Now, you may read that thyroid cancer is a hereditary disease. This is debatable, since most people diagnosed with the disease had no family history of thyroid cancer. Now, however, if a woman is exposed to radiation during pregnancy, the unborn baby may be in greater risk, among other issues, of developing papillary thyroid cancer in his or her preteen years. Exposure would include being closer than 0.5 meters of a person or items that have been exposed to high dosages of radiation within 10 weeks of exposure. Diagnosing the disease consists of a variety of tests, depending on your symptoms. A simple blood test can determine if the thyroid function has been disturbed, but if the physician suspects cancer, a radiation scan is often ordered. If a lump is visible, a fine needle aspiration can be done in office and will be sent off to the pathologist. Additional scans like X-rays, CT scans, PET scans, or MRIs may be used to determine the size and location of the cancer to see if the disease has metastasized. Papillary thyroid cancer is usually treated with a combination of surgery and radioactive iodine. Papillary thyroid cancer, again, it is treated with a combination of surgery and radioactive iodine I-131. Surgery would be either a total or partial thyroidectomy, followed by a radiation of radioactive iodine treatment to kill any remaining residue left behind from surgery. The radioactive treatment usually comes in a pill form and is taken with water. It does have a salty taste, but usually no side effects. Once diagnosed and treated, thyroid cancer patients are placed on a hormone replacement. An endocrinologist would be the one who would specialize in the handling of the care of a thyroid cancer patient, which would include managing medication and routine scans. Thyroid cancer patients are given a different range of medications than one that might say just had a thyroid disorder. Thyroid cancer patients must be given a higher dosage of medication to help block stimulation of TSH. Now, TSH stands for thyroid stimulating hormone. It is secreted by the pituitary gland. TSH is a hormone that would stimulate the cancer cells to grow. Thyroid hormone replacement levels must be checked often as to make sure adjustments are made when needed. Please note that the goal for thyroid cancer patients is to suppress the TSH as much as possible without causing hyperthyroidism. Please note it is important not to expose yourself unnecessarily to radiation. If you work around radiation, please take precautions. We all understand it is hard to eat right and exercise in this fast-paced world we live in, but it is important to be aware of our surroundings. We never want to be unprepared for battle, so try to care for your body now, so that if it ever needs to fight a battle like cancer, you will be ready. Now put down that cell phone and go outside. Breathe in some fresh air. Try eating a strawberry instead of a candy bar. Because remember, our lifestyle today might just mean a treatment tomorrow.